Hello, everyone. Thank you for being here today. I'm Jenny Murray, President and CEO of the National Immigration Forum. For our third webinar in the Leading the Way Spring Series, Solutions for 2024 and Beyond, we will be discussing a topic that has touched so many American families and how it relates to the border and immigration. Tragically, illicit fentanyl and other illicit drugs have ended up in the lives of hundreds of thousands of Americans. That includes nearly 75,000 deaths from fentanyl last year alone. And in the fiscal year 2023, 26,700 pounds of illicit fentanyl crossed the US-Mexico border. This is a 480% increase from 2020. But the majority of illicit fentanyl comes across the southern border and is smuggled through ports of entry by people who are entering the US legally. Today, to moderate our discussion on tackling the illicit fentanyl at the border, I'd like to welcome Christina Dent. Christina is the founder and president of End It for Good, an organization that works to find life-saving solutions to drug and alcohol abuse while reducing crime and empowering families. Christina, thank you and the panelists for being here today. Now over to you.
Thanks, Jenny. I'm super excited and honored to be here. This is such an important conversation affecting so many people in our country and around the world. And so I'm really thrilled to be moderating this panel. I came to this issue not as a policy analyst or expert, but as a foster mom who began to see the impact of addiction on children and families, on the fabric of society. And that started me on a learning journey, trying to figure out how can we solve these problems? Because it became very clear to me that what we were doing wasn't working. And that led me to learning. And that led me to learning about fentanyl, about why it's here, how it gets here, how we can better address it, and really rethinking everything that I thought I knew about drugs and addiction and how we can better approach those issues. And all of that is impacted and impacts immigration and what's happening at our border. And so I started End It for Good after my own learning journey to invite other people to rethink how we approach drugs and addiction, and ended up writing a book, which is a memoir of sorts on this issue. It takes people on my own learning journey of how a conservative Christian like myself came to completely shift the way that I think about the solutions that are actually going to solve some of these really challenging problems. So the book is called Curious. You can get it on Amazon, or you can email us at curious@enditforgood.com. We'd love to send you a copy free. We love to have these conversations happening. And so want to put that out there. But let me go ahead and introduce our panelists. Timothy McMahan King is a senior fellow at the Clergy for a New Drug Policy. He's also the author of the book Addiction Nation and owner of Vagabond Strategies. David Bier is the director of immigration studies at the Cato Institute. And Elaine Dezenski is the senior director and head of the Center on Economic and Financial Power at the Foundation for Defense of Democracies. And she's also a leader at the Council on National Security and Immigration. So before we dive in, let me tell you, go ahead and put any questions that you have in the chat box. If you want them to go to a particular panelist, just note that in your question, and we will have a time at the end. We'll take a few minutes to do some Q&A. So at any point while we're going along, if you have questions, go ahead and stick them in the chat box, and we'll ask those at the end. So Jenny gave us a little bit of opening context. I'll give a little bit more. With illicit fentanyl, we're talking about the leading cause of overdose death in the United States now. Fentanyl is far more potent than heroin. It is easy to produce because it is synthetic, so you don't even need to grow a crop in order to produce it. It's also incredibly cheap. So the price of fentanyl has dropped in half in the last 4 years alone. So our trajectory with fentanyl is not good. All of us want to solve this problem. So with this panel, what we hope to do is provide some background on why enforcement efforts are so challenging with fentanyl, to clarify the relationship between fentanyl, immigration, and the border, which is incredibly murky in terms of what we hear in the kind of mainstream media, and then offer some solutions. How could we actually solve this crisis that we're facing? So David, we're going to start with you. Give us a little background. How did we get to where we are with fentanyl today?
Look, I look at this from the economic perspective, the government has created a black market in illicit opioids by prohibiting their use, except in very narrow circumstances. And that black market has resulted in the creation of more and more potent substances. And this has been documented in virtually every type of narcotic that has been prohibited, ultimately results in more and more potent forms of that. We saw this even during alcohol prohibition, where you went to bathtub gin and imported liquors because they're easier to transport. And we've seen the same thing in the opioid market. Really, we had prescription opioids being the primary source for most people who are using opioids in the 1990s and 2000s. The government's response to that was to crack down and try to prohibit these substances from reaching those consumers, reducing the number of prescriptions, and ultimately those users then went on to heroin. Heroin was much cheaper, so there was a financial reason, but also the main thing was the supply had been reduced, and so people moved on to heroin. And then we had the transition to fentanyl, which is even easier and even cheaper to produce. Initially, it was mixed with the heroin that was coming in, and eventually it became so dominant that now people are using pure fentanyl in the streets. And it's what we saw is this crackdown response ultimately leading to these more and more potent substances coming in. And if you look at 2020 in particular, where this huge spike in overdoses started, you can see the effect of the crackdown at the border in the numbers of overdoses that are happening, as well as in the seizure data that came from Customs and Border Protection. Because at the start of the pandemic, before, in February of 2020 and earlier, fentanyl was a minority of the seizures that Customs and Border Protection was making when it comes to heroin versus fentanyl. About 2/3 of it was heroin. Then we shut down the border, restricted travel so dramatically, and the response from the drug smugglers in Mexico was not to give up on the American market. Instead, it was, let's shift to a more potent substance that's easier to conceal in luggage and bring that across the border. Because right now, if you reduce the number of flow, you can increase the percentage of packages that are being searched. And so when seizures went up, the response was to shift to fentanyl so you could supply the same market with 50 fewer trips, or a supply that's 50 times smaller than heroin. And by the end of those travel restrictions, we went from 1/3 of all seizures being fentanyl to over 90% being fentanyl. And so the crackdown resulted in an even more potent substance getting into the hands of consumers who were not requesting it. They preferred the heroin that they were getting, and obviously they preferred the prescription opioids that they were getting before. But this was entirely a government-created situation through intervention into the drug markets in 2020 and earlier.
So it's kind of this stair-step effect of, we had one thing, we banned that, we moved to another thing, we cracked down on that, we moved to another thing, and all the while it's getting more and more potent, which on the consumer front is not a win. It's a loss, because it is far more deadly for consumers who can't dose it appropriately because it's not regulated in any way. So we hear a lot of talk in the media connecting fentanyl smuggling with illegal immigration. What are the facts and the myths about who's smuggling fentanyl, how it's getting across the border? Because that's key if we're going to actually solve the problem.
Look, the biggest myth is that there are a bunch of people in Mexico or China or elsewhere who are just of their own volition, just deciding, let's bring drugs into the country. I mean, that's the perception. No, it is U.S. consumers who are paying people money to go get them drugs and bring it across the border. Now, how is that physically happening? It is mainly happening by U.S. citizens going across the border into Mexico, bring the drugs in their legal luggage, in tractor trailers, in other cargo that's coming in, concealing some of it. Doesn't take much to supply a huge market and bring it in for profit. And so that's the situation. 89% of all of the fentanyl trafficking convictions in 2022 were U.S. citizens. So this is primarily being driven by U.S. citizens, and it makes sense because they are subject to less scrutiny at these ports of entry than other travelers who don't have documents or who have a temporary visa of some kind. They're going to be subject to more scrutiny. U.S. citizens are guaranteed entry into the United States. So it makes sense for the cartels to seek them out, to hire them so that fewer drugs are lost when they're crossing the border. And the other component of this, of course, is that it is entering through legal channels primarily. It doesn't make sense to put a backpack on a bunch of people and send them across the border, because it's actually easier to detect a person crossing the border illegally than it is to detect a small quantity of drugs hidden in a huge tractor trailer or even in a backpack coming in legally, because not everything is searched that's coming across. And even if it was, there's always a nook or cranny that you can hide this stuff in. And so the reality is, this is mainly through legal travel. Even if we shut down the border completely, we'd still have U.S. citizens going abroad to get this stuff, because look, the demand is there. As long as the demand is there, people are going to be willing to go to great lengths to fill that demand.
Yeah, I remember somebody telling me one time it used to be that you had to smuggle a boatload of heroin. Now you can just smuggle a suitcase of fentanyl. To me, that was such a perfect mental picture of this shift towards higher and higher potency. There's far less risk in smuggling a suitcase than there is in trying to get a whole ship of something into somewhere. So most of it's coming across at ports of entry. Most of it is coming across with U.S. citizens. So what are some of the myths about border policy then that can get in the way of actually solutions to this fentanyl problem?
Look, I mean, obviously the biggest distraction is all this stuff about immigration, shutting the border, banning asylum seekers. I mean, of all the people arrested by Border Patrol in 2023, 0.009% of them had any fentanyl on them. So that is a huge distraction to having any kind of productive conversation about this. The other thing about this, though, that's important is, we have this idea that, well, fentanyl is so easy to conceal, and if it was just easier to detect, this whole problem would go away. And I have to tell you, I hate to burst the bubble on this, but that is totally incorrect. Marijuana was smuggled across the U.S.-Mexico border for decades and decades and decades, and it had all the enforcement we did. We hired 20,000 Border Patrol agents. We built walls to stop, in part, this traffic. It had no effect on the availability of marijuana in the United States. It increased the potency of marijuana, but it did not reduce the supply. And you have to understand, marijuana is orders of magnitude, multiple orders of magnitude easier to detect than fentanyl, which can be, concealed in a pocket and supply, an entire community. I mean, so the idea that we're going to just solve this by hiring more agents or at ports of entry through these detection technologies, just detecting more is not the answer. Right now, just to have a baseline for this, the Customs and Border Protection right now estimates that they interdict only about 3% of the hard drugs that are coming through ports of entry. So we're not anywhere close to getting to a point where this is going to have any effect on the drug market in the United States. And even if we increase that tenfold, it would have almost no effect on the price, because it's so cheap to produce. It's like basically 1 cent to produce. You're selling that for $1 in the United States, so 100-fold increase in profit. So the economics on this doesn't make sense. It's not going to work. We need other solutions to this problem. It's not about shutting down the border.
That's super helpful. Tim, shifting to kind of from that economic lens to a personal lens, you've used fentanyl under medical care. You've lived through an opioid addiction. What was your experience and what did you learn that would help us understand kind of the consumer side of what's actually happening with addiction, which is so much of people's fear related to drugs?
Thanks, Christina. Yes, it was about 15 years ago. I went in for what I thought was going to be a routine medical procedure. I ended up in the ICU in acute respiratory distress. My doctors called my family in to come and say goodbye. I did make it through after a few months in the hospital, but was sent home on heavy doses of hydromorphone, another opioid that is more potent than heroin, as well as fentanyl, and eventually developed an opioid use disorder. Now, that's not inevitable. In fact, while opioids are addictive, it's important to know that under medical supervision in particular, opioid addiction is still rare, putting it at the highest rates at about 12 to 15% of people who are prescribed opioids over the long run. So it's not an inevitable thing. It's not something that everyone needs to be deathly afraid of. It's something to be conscious of, and it's something to be aware of that potential in order to mitigate that risk. But the other thing about my situation is because I was on prescribed opioids that were pharmaceutical grade and well dosed, the concern for me was around addiction and some of the potential long-term physical effects there, a restriction in my own sense of liberty and choice because I felt compelled to use. And those were real concerns. But because I had access to high quality, well dosed, overdose was not a significant concern in my situation. And then it was years later, after I had not even needing inpatient treatment, but just some outpatient support through cognitive behavioral therapy and alternative pain management, moved back home to my home state of New Hampshire in 2015. At the time, the county I grew up in was one of the highest per capita fentanyl overdose rates in the country. And I kept hearing about people I played t-ball with or soccer with dying from a fentanyl overdose. I had not heard that word in years at that point. And realizing that one of the big distinctions here was not that I was a better person or more moral or more upstanding, but the distinction was a policy reality and the shifts that occur in these drug markets that David was discussing. That the people who maybe had been on some Oxycontin when they were a teenager, when they broke their arm, or maybe had experimented at a party later on and found themselves addicted to a pharmaceutical grade pill at some point, were moving up that ladder to drugs that were unregulated and far more dangerous, not because the drug itself has to be dangerous, but because illicit markets don't have any kinds of protections for the people who are consuming those drugs. And so it is an important distinction to ask, what is at the heart of our concern? Is this something that we just want to get rid of, like COVID? We just wanted to get rid of it because getting COVID doesn't really serve a benefit. Or are drugs more like something like fire? They have huge potential positive roles to play in our lives. Every time we drive a car, we are harnessing the power of fire to get from here to there in our internal combustion engines. And we know fire can be an incredibly destructive force. And if we're talking about COVID, then yes, we want to get rid of COVID the best we can because we don't want people to be infected. But if we're talking about drugs being more like fire, then our concerns should be to understand the nature of how fire functions. What are the different forces at work? What are these economic pressures that David was discussing? And then how do we create systems that respond to the nature of those different forces? And having a clear-eyed view of what those are. We've never had a period in human history where we haven't had people using some sort of mind-altering substance. And then we can best create those systems to try to reduce potential harm and to make sure that we aren't having overdoses while knowing that, yes, maybe people will get addicted, and that's a concern. While people are alive, we always have the chance to help them, to support them, for them to find more stable lives, or for them to enter into some sort of recovery. So I think one of the big mentality shifts we need to say is fentanyl is not evil. It's not to be eradicated. It is best for us to try to take these substances that can have good applications in some areas and try to create systems that mitigate risks while maximizing potential benefits.
Yeah, that's helpful. So help us understand how we got to where we are in terms of the way that we think about drugs in the US is largely this moral issue. And you've done a lot of research on this, the history of drug policy, how that has been connected to immigrant communities for 100 years or more. Give us a little bit of that to help us understand the context of why so much of the discussion now is through a lens of morality related to drugs, and why this connection to immigrant communities is not new.
Yeah, and so if we look all the way back, you go back to early religious texts, from Buddhism and Hinduism into Judaism and Christianity. You look at the Hebrew scriptures. Wine was always discussed as being fundamentally a gift from God, the gift from the divine to make the hearts of humans happy, and there was a potential of it being misused. And that was our primary understanding, not just of wine, but of things like opium, right? In the 18th and 19th century, a common way to refer to opium was God's own medicine, because at the time, before the rise of modern pharmacology, one of the few things that doctors had that consistently made people feel better when they felt bad and alleviated pain was opium. If you had dysentery, opium was a highly effective treatment. You have tuberculosis or something respiratory issue, opium was a highly effective treatment. So for most of human history, all of our discussion has been opium is a divine gift. Then we do have the rise of more potent versions of opium, and we see increasing problems with addiction, behavioral issues, with the rise of use of morphine and then heroin. And so, in the turn of our last century, people are seeing these increased problems. And in particular, there was a missionary bishop, an Episcopal bishop over in the Philippines, who saw the rise in use there, and he was significantly concerned. He also understood the history of Great Britain fighting two wars to force open markets in China when China had been trying to control use in their own country. And he with that rise in concern, happened to be friends with our president at the time and was saying, we need to do something. We need an international conference on narcotics to address this issue. Now, in the United States at the time, one of the pressing issues for overdoses was not with adult users, it was with infants and babies, because we had a completely unregulated market of patent medicines where people would put in heroin into or morphine into these different drugs and not even label it. So there would be different medicines you would give to babies to soothe their cough or to help them sleep, and parents would be unwittingly giving them heavy doses of morphine, and that could end up with a fatal overdose. And it's the way the historian David Musto tells the story. Congress tried to pass legislation around the issue of regulating these patent medicines, but failed. And this missionary bishop going into this conference wanted to show that the United States had some legislation. So he's saying, hey, if Congress passed something to show that we're taking this seriously. And some legislators realized that the best way to pass something in Congress was to stoke fears around Chinese immigrants, who, after the finishing of the railroad, there were economic anxieties there, and Chinese immigrants were known for smoking opium. So one of the first big legislative pushes of Congress was around the restriction of opium smoking. And as Musto puts it, Congress couldn't rally itself to protect babies and infants from overdoses, but could target Chinese immigrants because of that fear. And so there has always long-term been this connection between different immigrants, communities, fears of diseases, as well as fears of drugs. So we saw that with cannabis in connection to Mexicans. We saw that with crack cocaine in connection to Black communities. If we have anyone who is other, not just immigrants, anyone who can be considered an other, there's often that tie to the fear of the substances themselves. And now this can be unfair to those populations directly, but then we also have the problem that while Congress wasn't doing anything to regulate patent medicines that were killing infants, they had the illusion of doing something by targeting Chinese immigrants. So I think the closest analogy today is what David was talking about with our border. Is we are talking about walls, we're talking about significant immigration restrictions, while completely missing the fact of how fentanyl is getting into our country. And so there might be people who are players in this drama, and that might be true, but we need to distinguish between people who are players in larger market forces well beyond their control and what's actually causing our crisis at the root of it.
Yep. I love that. Elaine, I want to move to you. So we hear a lot of talk now tying fentanyl to illegal immigration. You've spent years working first at the Department of Homeland Security, then on Customs and Border Patrol issues, now particularly on fentanyl. Help us understand this kind of money laundering, kind of start to finish aspect of fentanyl, why it's so difficult to stop.
Right. First of all, thank you for inviting me to the conversation. This is a great holistic discussion on fentanyl as a serious risk in this country. So I really appreciate how you're pulling this together in these different threads. So I have a slightly different entry point into this conversation. So here at the Foundation for Defense of Democracies, we're a foreign policy think tank. I run the Center on Economic and Financial Power, and we deal with a lot of issues around the US-China relationship, around economic statecraft, sanctions, illicit finance, corruption, all kinds of aspects that may or may not touch the fentanyl challenge, but there are some pretty serious connection points when we look at the economics of how fentanyl flows and who's involved in that process. So that's what I really want to talk about here, starting with the money laundering side. So one way that we could think about the fentanyl challenge is a money laundering crisis fueled by a drug crisis. So what do I mean by that? So if we look at what's happening around the flow of fentanyl, the dollars that are generated from this and how they move through an international financial system, it's a pretty unique story. So it centers around the US, China, and Mexico. The US in terms of consumption and the role of US-based money launderers, Mexican cartels who control the flow of drugs, and for the most part, the production of those drugs. And then from the Chinese side, the flow of precursor chemicals into the processing of fentanyl, primarily into Mexico. Now, I'll say at the outset that we do see other elements, geographic elements to this problem, including more and more engagement coming out of India. So I think that over time, these dynamics could shift, because as we close one potential way to move fentanyl into the country, there may be others that pop up. It's just there's too much demand and there's too much money to be made. So we should expect that these dynamics are going to change. But let's go back to how this system is working. So if we kind of start with the US piece of this, so there's demand for fentanyl. Others have talked about the origins of that demand, why we have this challenge. So there's clearly, a demand coming from the U.S. consumer for fentanyl because it's an illicit substance. It's primarily being trafficked into this country through Mexican drug cartels. These cartels push the product through. We know that, and it's absolutely correct that most of it is coming through ports of entry. It may be a land port, but it also can come through maritime domains and even through the aviation environment. So there are multiple ways that this product moves in. When this fentanyl is purchased, it's typically purchased in cash. There may be some crypto involved as well, but let's focus on the cash part of this. So the problem with cash, of course, is getting it back across the border to the Mexican cartels. They want their money, but they need an intermediary to do that. And it is actually somewhat challenging to move bulk cash back and forth across the border. So to avoid that situation, the money laundering component has really expanded in the US, and it's primarily controlled by Chinese nationals in the US who are serving in this intermediary function. And this is important to understand because it's linked to a broader organized crime problem coming out of China, but we'll focus on these Chinese money laundering agents, let's call them, who are basically collecting this cash. They're paying the Mexican cartels in pesos. They take a cut on what goes back to the cartels, but they guarantee, for the most part, to the cartels that they're going to get paid. So they reduce a lot of the risk for the cartels. So what do they do with this U.S. cash? So this links to another problem, which has nothing to do with fentanyl and everything to do with capital controls on Chinese expats living in the U.S. So there is a prohibition on the movement of more than $50,000 coming out of China and into the U.S. So if you're a Chinese national and you're living in the U.S. and your children are going to university, you're buying real estate, you're doing all kinds of things, all of which is probably lawful. You need cash to do that, to support that lifestyle. So Chinese money launderers market those US dollars. They are exchanged for yuan. That exchange happens in China through Chinese banks. So the US dollars are then bought by nationals who don't have access to that US currency. The transaction is happening through Chinese banks, so we don't actually see that. And then in the meantime, the pesos that are paid to the Mexican cartels can then be reinvested, and yuan can be purchased for effectuating the precursors coming to China, or to Mexico, I'm sorry. So what I'm describing at a very high level is this system around the flow of funds, which reflects transnational criminal organizations and connecting the need of fentanyl users with the need of individuals who don't have access to US dollars, with the objectives of Mexican cartels and money laundering organizations that are involved in China with the precursor production process. So it's complicated. The FBI has said this is one of the most complicated money laundering scenarios they have ever seen. And we can talk about ways to go after that, but it's another layer to this problem. And it's important to understand that the interdiction is absolutely not going to work. We really have to think about cutting off the money, cutting off that flow of funds at certain critical points in this process to be able to really dismantle the system that has been built around this demand.
That's super helpful, thinking about it as a money laundering problem with drugs attached to it, more so than it is kind of a drug problem. It is drugs are an easy way to launder lots and lots of money. So we're going to take about a minute each to offer. We understand the big picture problem much better, why it's happening, what's driving it. Leave us with some great, just the highest level solution that you see from your point of view. Elaine, I'll start with you. Give us the, hard, harder, hardest, better, worst, whichever way it goes. Give us about 1 minute each of what can we do to turn the tide on fentanyl.
Okay, so three conceptual frameworks for this on exactly what you said. We have pathways that are hard, we have pathways that are even harder, more difficult, and then we have ones that are nearly impossible. It's nearly impossible to stop the interdiction or the flow of fentanyl coming into this country for the reasons that we've already talked about. We will not be successful by simply pushing lots of resources into interdiction. We probably need to do more of it, but it's not enough. Starting with what's hard to do, but there's still opportunity, that's following the money and interrupting the money laundering that fuels this trafficking operation. We're talking about drug trafficking as an illicit industry that generates $650 billion a year. So we can go after this. We need to do more investigation into the money laundering nodes, the organizations behind that, and we have to have more financial transparency around the use of shell corporations. We need access to understand what Chinese banks and other banks are involved in effectuating these transfers. That's hard, but it's not impossible. The harder option from there is disrupting the supply of precursor chemicals from China to the US. This is extremely challenging because these chemicals have licit and illicit uses. So being able to separate that and understanding which one is which is very difficult. And then the most challenging, as I said, is actually interdicting the pills.
David, what about you? Biggest picture solution. What can we do to turn the tide?
Look, the most important thing is demand. American consumers have a lot of money to spend, and as long as they're requesting someone go get them drugs, it's going to happen. And that's the issue. Is why are people requesting it? Look, the answers there are not simple. It's it's mental health, it's pain management. I mean, look, you have people who are treating their pain. The number one reason, according to the surveys that the government puts out, the number one reason for prescription opioid misuse in the United States is pain management. So, are they using it because it's a lot cheaper to buy it on the black market versions of these drugs than what they're getting from a pharmacy? These are all questions that need to be explored. We need doctors to feel empowered to treat addiction, and make sure that people have options that are not black market fentanyl or black market heroin that may be laced with fentanyl. So you need to empower physicians to help people manage their pain, and also manage and ultimately eliminate their addictions. The most important thing we can do for people is keep them alive. I mean, people don't want to die. People are resilient. Many people get over their addictions to these drugs, and the idea that we should push them towards more harmful options and make sure the only option you have is to use some sketchy dealer on the street, that's not the answer. We need to get people back into a regulated market where there's help available. We need to make sure that there are safe injection sites and places that people can go where if there is a problem and they do overdose, there's help available. Those are illegal throughout the United States as a result of congressional action. So that's a federal solution. And states and localities make sure that you've legalized fentanyl test strips so that consumers know what they're consuming, can weed out contaminated drugs. A lot of states treat that as drug paraphernalia. So those are some ideas. Help deal with the demand side first, and stop spending so much effort and billions of dollars on the supply side.
Super helpful. Tim, our best solutions.
So one of the first, I think, is a conceptual shift, and to understand that with the rise of fully synthetic, incredibly potent drugs, that most of what Congress is talking about today sounds as if they are still discussing how to regulate the telegraph, where we are in an internet age. That is how big the difference is between the problems that we faced in the past and the problems we face today. And so the solutions need to be outside the box. One of the things that David was speaking about too is radically expanded options for medication for opioid use disorder. From what we have now, easier access to things like buprenorphine and methadone, to also making sure that just like I continue to have access to safe, legal forms of opioids while I had a substance use disorder, the most important priority that my doctor put on me at that time was my own life. And we need to prioritize people's life before we do forcing them off of a drug on a particular timeline. And that alone will not only save a lot of lives, it's also something that we know the illicit market right now is thriving off of a small number of consumers who are the heaviest users. If we are able to create an alternative pathway for those folks that keep them alive, we could also cut out 80% of the market share that the cartels are currently serving. And that would take away a lot of money from people who are currently using those forces to build up paramilitary organizations and create instability in the countries that a lot of folks are fleeing from. So it won't be easy, but we need to consider that we are in an incredibly different era, and that the solutions of the past don't just fail, they often make the situation worse.
Super helpful. All right, we've got questions rolling in. I'm going to send one each your way, and then we'll let Jenny close us out here. Elaine, this one is for you. How much has been done yet to break the money chain associated with fentanyl? Is this a congressional or administrative responsibility? Take about a minute and give us your thoughts on that.
Thanks. That's a great question. So I would say it's probably falling within both categories. There's more that Congress could do, and there is some actually some new legislation that expands sanctions capabilities and authorities to go after actors within this fentanyl supply chain. So I think that's good. But there's, one part of this which is really challenging, and that's getting the Chinese government to work with us on the precursor chemical problem and the money laundering connections back into Chinese banks. That's proving more difficult. We're just not getting that much cooperation from Beijing. That's tied up in a broader set of geopolitical tensions and issues. It's almost become a bargaining chip to some extent in the US-China discussion. Because Beijing knows that we want to desperately solve this problem, and they really haven't been that helpful. So it's going to be challenging to get there, but there's more that we could do to try to push that conversation to go after those money laundering operations. There's also more that we can do on the investigative side, and this may be more of a resources issue, but Customs and Border Protection is responsible for the interdiction, but then we have the Homeland Security investigations, a federal force that is responsible for investigating these cases and going after who these individuals are operating on US soil. Are they using shell companies, front companies that are basically anonymous corporations? So breaking that down just requires a lot of investigative resources. So we should be doing more on that front as well.
That's helpful. David, this one is for you. Is there another drug that could replace fentanyl given the discussion around producing stronger drugs with less volume?
Yeah, nitazines are waiting in the wings. We've already seen them showing up in drug overdose reports in Tennessee and the UK. So these are spreading. This is another synthetic opioid that's about 20 times more powerful than fentanyl. And there's not really a theoretical limit to how potent these drugs can get. It's just the creativity of the manufacturers. And so, it's just there. It's not like fentanyl's, well, this is the end of the line and there's nothing else they can do to make it an even more potent substance. They will keep inventing additional substances that meet this demand and also manage to evade interdiction along the way.
Yeah, that's good. Tim, this one is for you. What can average people do to help the country move in a better direction towards solutions?
I think one of the most important things is what we understand from substance use disorders is that harsh confrontations, those big interventions you might have seen on TV, not only don't work, they often make the situation better because it assumes the worst about the other person. And people often, one thing that's often said is people have drug solutions before they have drug problems. Drugs, often people seek them out because they have something like pain or some sort of mental malady that they are trying to treat or self-medicate. And so when we understand that people who become addicted often started off with very good intentions of what they were hoping to do in their own lives, we're actually able to help folks a lot more. And the same is true, I think, for people who disagree with us politically. So if we're talking about folks who are concerned about a border wall, who do want to stop immigration, I think one of the important things for us to do, for those of us who know that these are false myths, is to address them, but to address them with compassion towards those who hold those false beliefs. Because those false beliefs also are playing some sort of protective role in that person's life. You grew up in a town like I did. I talked to a friend who lost half of his male graduating class from overdoses and alcohol. And for somebody like that to see so many people in their community die, they are desperate for some sort of narrative that makes sense to be able to stop the deaths they're seeing every day. And so while we might disagree with other folks about what the solutions are, to address that with compassion, to know that if people are focused on the border or stopping immigration, we need to understand that's coming from a place of fear and to address that fear and then also help them engage in more helpful narratives and understanding the true causes of the crisis that we're seeing.
That's so helpful. One comment that came in was, is fentanyl really even an immigration issue? It feels like an oversimplification of the problem. And I think so much of what you guys have shared today has helped us see kind of maybe a misapplication or misconnection that we're making, where the solutions lie in some different areas. So thank you all each so much for your expertise. Jenny, I'll pass it over to you to close us out.
Thank you all. And Christina, thank you for leading that really substantive conversation. You all did an incredible job distilling a very multi-layered topic. We really appreciate you joining us today. I just want to let everybody know we dropped one resource in the chat. We have an illicit fentanyl and drug smuggling at the U.S.-Mexico border overview that we dropped in the chat, but you also have at least 2, maybe 3 authors here and wonderful organizations represented on this call. So do feel free to look up also their organizations and their resources. We really appreciate you, Elaine, Tim, David, and Christina. Thanks for joining us for this conversation. If you've been following along with the webinar series, number 4 is next week. We will be tackling the U.S.-Mexico border. So we'd love for you to join us for that 4th segment in this series. Thank you all. Have a wonderful day.